Hello, my name is Warren Furry, and I'm the Patient Care Coordinator in the NICU at Lehigh Valley Health Network in Allentown, Pennsylvania. The NICU I work in is a Level 4 NICU, and a Patient Care Coordinator would be described in other facilities as Assistant Manager or Assistant Director. I believe my message can help any nurse leader. However, new nurse leaders may really find my message helpful. Empathy. We start learning about this process of thinking about others in our first nursing class. It is something we learn to use to connect with our patients and patients' families each and every day we do our job. Over time, I believe that we have forgotten to be empathetic towards ourselves while we are working. Why is this important for nurse leaders, especially new nurse leaders? Part of Webster's definition of empathy is being aware of, being sensitive to, and vicariously experiencing the feelings and thoughts of another. Recently, I heard a prominent figure talk about an experience during one of the recent hurricanes in the Carolinas. While visiting there, coming out of a convenience store, he saw an electrical line worker up in an elevated basket and yelled thank you to him. The worker said, "What was that?" and began lowering the basket to the ground. "Thank you," the man yelled again, with the worker responding, "What did you say?" As the worker made it to the ground, the man said again, "Thank you." The worker looked stunned and said to the man, "In all the years I've been doing this job, nobody has ever taken the time to stop and say that." As leaders, we face opportunities such as this every day. Initially, when I heard this story, I connected immediately with what was happening, as saying thank you is something I have really been using as a staff engagement and recognition tool over the past few years. I look, without even thinking about it any longer, for reasons to say thank you, and I've learned the importance of following up to the verbal, on-the-spot thank you with a formal email to the individual or group. This is important to those being recognized and also gives you a record for future activities such as staff evaluations that you can use the information for. I say thank you to someone who has done a great job, to someone who has had a difficult day and has made it through, to the staff who have had a difficult or busy shift and have come together as a team without prompting or instruction to do so. In the last situation, I include the physicians and nurse practitioners that were working too. The first time I did this, what a shock. The physician was amazed that I would think of them too with everything that was going on. I find it amazing that people may not know how to react when being thanked. If you are a new leader, this is something you should be prepared for. To wrap up, remember, thank you is something we have all probably been taught at a very young age. However, in all aspects of society, we seem to have forgotten this simple kindness and easy way to recognize someone for something they've done. It has become so easy to criticize and bully people into doing what needs to be done that we have to take a step back and remember that thank you can earn you many followers and a good deal of respect. Thank you.